If there's one town in Australia where the new no jab, no play policy will be put to the test, it's Mullumbimby in northern New South Wales. Earlier this week, the federal government announced that welfare benefits will be denied to people who refuse to immunise their children. In Mullumbimby, the vaccination rates compare to South Sudan. The question is whether the hardcore activists there will be persuaded by the government's economic squeeze. Peter McCutcheon spent the day in Australia's anti-vaccination heartland.
This is Mullumbimby in northern New South Wales, the town with the lowest rate of childhood vaccinations in Australia.
There's a whole lot of stuff being put into a little baby, and we probably won't know for 10 or 15 years whether it really does do the job.
You don't even know what's in the vaccinations to begin with, so I think it's a bit of a joke.
We have a vaccination rate here in Mullumbimby that equals that of the developing country of South Sudan, which under 50% of kids aged 5 are fully vaccinated.
Heidi Robertson feared she would lose her baby after contracting whooping cough late in her second pregnancy. The frightening experience motivated her to join with other concerned citizens to help save lives.
In this area, vaccination was like a taboo subject. It was like bringing up religion or politics at a dinner party. You just didn't do it.
Talking to people here in Mullumbimby, I'm struck by the diversity of opinion. It's not a simple black and white issue. In fact, many people openly admit to being confused.
It's a really right on the edge subject because it's the care of a child and it's the care of the community around you as well. But it's really hard to get to the bottom of, and I've really gone along pretty much, sounds a little bit weird, but I've gone along with what my wife wants to do. And
Which is
Which is not to immunise, but I don't really know the answer, and I reckon there's very few people that know the answer.
The answer, according to the federal government, is to cut more welfare payments from parents who don't immunise their kids. From next year, parents who receive child welfare and family benefit supplement payments can no longer claim an exemption from immunisation on the grounds of holding a philosophical objection.
So this is a very significant narrowing of the exemption grounds that apply to immunisation, and for one very, very good reason, and that is we want to make sure that our kids are healthy, that our families are healthy, and when you put your child in a childcare facility, then you can have that confidence.
Labor understands that there are a very small number of people who have deeply held religious convictions. But other than that, Labor sees no case at all for parents not to be encouraged to immunise their children.
Look, I think it's a very bold move. I think it's about time the vaccination got the national attention that it deserves.
Surgeon and vaccination campaigner John Cunningham supports the government's stance.
Certainly we need to monitor the results of this new program. Certainly it will certainly target the people who have fallen behind on their vaccination rates because of forgetfulness or difficult to access or other reasons like that. It'll be interesting to also see the way it affects the people who are the conscientious objectors, who are currently about 50% of the unvaccinated population of Australia.
It's those conscientious objectors that immunologist Professor Robert Boy fears will be hard to sway.
There are better ways to approach hesitant parents. And if we take the time to listen to their questions as health professionals, if we give high quality information, most parents who are hesitant will go and get their children immunised. Immunisation sells itself. You don't have to coerce people.
Professor Boy fears the no jab, no pay policy could have unintended consequences.
If we go down this punitive and coercive approach with the public, I'm concerned that we'll get people building up movements against immunisation just because they're feeling paranoid and coerced.
Back in Mullumbimby, there are complaints of government heavy-handedness, even from those who vaccinate their own children.
Shouldn't be pushed upon you at all.
Yeah, it's their belief. Like, you know, everyone has different beliefs. We don't force religion on other people.
The Northern Rivers vaccination supporters are not sure how many locals, particularly those who are still undecided about the benefits of vaccinations, will react to the government's crackdown.
We're taking a bit of a wait-and-see look approach to that because...
Why is that?
Well, the reason for that is that there hasn't been any research done into unique demographics like ours here in the Northern Rivers. We just simply don't know if it's going to work or if it's not going to work.
However, it's not too hard to find parents who welcome any attempt to make this community safer for infants and young children.
Actually, I think it's a really good move because with a newborn myself, and particularly in this area, it's a huge concern of mine.
I'm a nurse, I see people in the hospital and the children getting really sick, and it's horrible and it's so preventable, and I think people should prevent it if they can.